NeedyMeds users and friends. Thanks so much for joining me today. I'm Carla, the Director of Education and Partnerships at NeedyMeds. And today we're going to talk about Dr. Sagall's 7 secrets to save on medications. First, I'll offer a few tips so you can make the most out of the presentation. You can ask questions by typing them into the questions section of your GoToWebinar control panel, but I will reserve answering questions until the end. If I don't get the chance to answer your question, I will follow up with you by email. I will, of course, provide my contact information as well as the contact information for NeedyMeds at the end. This webinar is being recorded and will be available on the NeedyMeds YouTube channel. And during this webinar, feel free also to check out that handout section of your control panel. That's where you'll find a copy of my PowerPoint slide deck. With this presentation, I will cover what NeedyMeds is, the healthcare savings resources we offer, Dr. Sagall's 7 secrets to medication savings, and I'll also offer some easy ways you can stay in touch with us. So let's get started with what is NeedyMeds. NeedyMeds is a national nonprofit co-founded more than 2 decades ago by retired family physician Dr. Rich Sagall and his friend Libby Overly, who was a medical social worker. Rich is still the president. On the screen is our mission statement, a statement about how we achieve our mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And to find healthcare cost savings resources on NeedyMeds, simply go to that Patient Savings tab, where you will find a whole bunch of different categories on ways to save on your meds and other healthcare costs, including savings on prescriptions with prescription assistance programs, and through our $4 generic drug discount programs, with our free low-cost and sliding scale clinics, coupons, rebates, and more, diagnosis-based assistance programs, our new section, the COVID-19 Resource Center, which is full of programs for those experiencing financial hardships and struggling with healthcare expenses due to the pandemic. You can find assistance with medical transportation costs, retreats, camps, recreational programs, and educational scholarships. You can find government programs listed by state, and of course a link to the NeedyMeds drug discount card. But you may already be aware of our resources and other common ways to save on meds, like shopping around for the best price, switching to generics, and splitting pills. Today, I'll showcase other ways to save you may have not seen before with Dr. Rich Sagall's 7 secrets to medication savings. Rich, again, NeedyMeds co-founder and president, put these tips together himself to share with NeedyMeds users. Now, these tips may be a little bit complex, but they may help if other methods have failed, and they may also give you better understanding of your treatments and the medicines you take. So let's get started with secret number 1. Are you treating the symptom or treating the cause? When you're sick, you want one thing: to feel better. Your healthcare provider may give you symptomatic treatment. For example, a medicine that lessens your symptoms. Examples include an antihistamine or decongestant, which may help with the runny or congested nose of a cold. An antidiarrheal medication may help with the runs associated with the stomach bug. Or an anti-itch medicine may help with the itch of a rash or insect bite. While all of these treatments may make you feel a little better, they do nothing to speed up the healing process and may actually delay healing, but they certainly help to empty your wallet. These symptomatic treatments are optional. It's up to you whether you want to spend your money on them or not. Secret number 2, do you really need that medicine? It's important to remember that not every medical problem needs to be treated. The body has remarkable healing powers. Daily, we are exposed to all sorts of germs, most of which the body deals with just fine. Many aches and pains are usually the result of normal activities, don't need any treatment except ice, heat, or rest. One common example is lower back pain. It's very common and rarely serious. Around 80% of adults experience it at one time or another, and at any moment, 15 to 20% of adults aged 45 to 64 have back pain. According to the Cleveland Clinic, 60% of back pain sufferers recover in 1 to 3 weeks, 90% in 6 to 8 weeks, and 95% in 12 weeks. The treatment received or no medical treatment makes no difference. In fact, less than 1% of back pain has a serious and treatable cause. Most minor respiratory problems, stomach bugs, sore throats, and other self-limiting illnesses don't need any treatment by a healthcare provider. It's rare for a person experiencing self-limiting and self-resolving symptoms to be afflicted with a serious illness. You'll do just as well without any treatment. Let's move on to secret number 3, polypharmacy and deprescribing. Polypharmacy is the use of many drugs. The definition of many depends on who's defining the term, but the cutoff is generally 5 or 6 drugs. There are many causes of polypharmacy. These include treating multiple diagnoses at the same time, taking drugs not prescribed for you, excessive use of over-the-counter drugs and supplements, multiple prescribers caring for you with no one prescriber overseeing the medications, and lack of stopping no longer needed or ineffective drugs. Deprescribing is the opposite of polypharmacy. It's the stopping of no longer needed medications. The process of deprescribing involves evaluating each drug, asking if it's keeping you happy and healthy, or if it's no longer needed. Examples of unnecessary drugs include drugs used to treat a now resolved issue, an ineffective drug that was never stopped, or a drug used to treat a now resolved side effect of a drug. While polypharmacy will increase your medication cost, proper deprescribing offers the opportunity to lower your medication cost by eliminating unnecessary medications. Added benefits of deprescribing include reducing the risk of side effects and potentially serious drug interactions. Secret number 4, combination drugs. While most medicines contain a single active ingredient, there are some that contain 2 drugs that are used in combination to treat a specific ailment. For example, some creams or ointments for skin conditions may contain a steroid plus another active ingredient. There are also blood pressure medications that contain a diuretic plus another blood pressure drug. The advantage of combination drugs is better compliance, because you only need to take 1 pill rather than 2, or you only have to apply 1 cream or ointment instead of 2. The disadvantage is that sometimes you have to pay for this convenience because the cost of the combination product is greater than what you would pay if you bought each drug separately. Always check to see what's cheaper, the combination medicine or buying each drug separately. Sometimes the combination is cheaper, but often it's not. The difference is what you pay for convenience. Let's move on to secret number 5, over-the-counter versus prescriptions. Regularly, the Food and Drug Administration is approving over-the-counter versions of medications that formerly were available only by prescription. For example, look at all the non-steroidal anti-inflammatory drugs and acid suppressors. All used to be available only by prescription, but not any longer. There are two differences between over-the-counter and prescription versions. One is the dosage. The over-the-counter drug usually contains around half as much active ingredient as the prescription version. Over-the-counter ibuprofen pills, for example, contain 200 milligrams of the active ingredient, while the prescription version contains 400, 600, or 800 milligrams. The second difference is the price. Often, but not always, the over-the-counter is cheaper than the prescription version, milligram for milligram. But this isn't always the case. With most of these drugs being a Tier 1 drug in insurance plans, the copayment may make the prescription version cheaper than the over-the-counter version. It pays to check and see. Another reason to consider the prescription version of a drug also available over the counter, is that your insurance may pay for the prescription version, but not the over-the-counter version. Secret number 6, supplements. In this category, we include most vitamins, herbal supplements, weight loss pills, immune boosting products, and muscle building supplements, for example. They are considered dietary supplements and have not been evaluated by the FDA for safety or efficacy. According to FDA regulations, they should contain the warning, "These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease." Another way to put it is these products are assumed safe until proven otherwise. Assumed safe should not be confused with being safe. Rather, it means we don't know if they're safe because they haven't tested them for safety. All too often, they turn out to be unsafe or not an effective treatment. In fact, supplements are one of the major causes of liver disease. They don't work and may interfere with your prescribed medications. The bottom line is you shouldn't waste your money on them. Secret number 7, don't buy more than you need. There are many reasons why you may stop taking a medication prescribed for you. It may not work, you may have side effects, or it may interfere with another medicine you are taking. So you end up disposing of all of the untaken portions of the prescription. It's like throwing away money. When starting on a new medication, it's best to ask the pharmacist if it might interact with any other drug you are taking. In many cases, you can get less than the number of pills prescribed to give the medication a trial. If the medication causes no problems and it is effective, then you can have the rest of the prescription filled. You can also ask the prescriber if samples are available. If so, you might be able to get a week or so of free meds to try before you spend money. When buying over-the-counter medicines, you shouldn't buy more than you need. The price per pill is less when you buy a larger bottle of pills, but the savings is lost if you only take a few and the rest go unused until they expire. So those are Dr. Sagall's 7 secrets to medication savings. That's his list of ways you can control your healthcare costs, and in some ways, your health. Although some may be difficult, all are achievable, and the added benefit to saving money is living a longer and healthier life. But we're not done yet. Rich also added 2 bonus ideas. The first bonus idea is clinical trials. The FDA puts all new drugs through an intensive screening process before they're approved. Although initial phases of this process start with testing on lab animals, the later phases involve testing on humans. People enrolled in these studies receive free medical care, medications, and follow-up. Depending on the study, participants may receive new drugs with the potential of improved treatment. All these studies must be approved by the FDA and by at least one institutional review board. This protects the participants and ensures testing protocols are ethical. You can find out about these studies at www.clinicaltrials.gov. And Dr. Sagall's second bonus idea is lifestyle changes. The best way to save on medication costs is to stay healthy and not need medicines. According to the book, Exposing 20 Medical Myths, about 40% of our life expectancy is determined by things we do or things done to us. Things like smoking, drinking, doing drugs, being obese, being a victim of violence or accidents. Another 30% is due to our genetics. Social circumstances, such as living in wealth or poverty, determine 15% of our life expectancy. And environmental exposures, whether or not you live around lots of pollutants, account for another 5%. That leaves 10% to medical care. But that 10% can be more expensive than the cost of the other 90%. The best way to control the cost of this 10% is to control the things we can control, the lifestyles that are detrimental to our health. Lifestyle changes such as quitting or not smoking, regular exercise, good eating habits, and getting enough rest may not be easy, but they're not costly. Lifestyle changes are the first step in treating adults with diabetes or high blood pressure, for example. For some patients, weight loss and diet, along with smoking cessation and increased exercise are all that's needed to control these conditions. Lifestyle changes are cheap and may even put extra money in your pocket. I do hope you found these tips useful. If you would like to share them with others, we will convert this presentation into a video and post it to our YouTube channel. I suggest subscribing so you won't ever miss out on our videos, presentations, or webinars. It's a great way to keep in touch. So let's move right into talking about other ways you can stay in touch. So on the top right hand of the NeedyMeds homepage, NeedyMeds.org, you'll see a bunch of icons. Since I just mentioned our YouTube channel, you can find an icon to that on the top right with the rest of the other social media icons, including Facebook, Twitter, Instagram, and Pinterest. You can also find us on LinkedIn. And I also suggest subscribing to our blog, the NeedyMeds Voice, where you can read timely, provocative pieces on healthcare-related topics. Now, under the Advocates tab, which is right next to the Patient Savings tab on NeedyMeds.org, you will find our subscription services. Here, you can order print materials such as our drug discount cards and brochures, and sign up for email alerts about program changes, for example. Under that Advocates tab, you can also sign up for upcoming webinars, our monthly e-newsletter, Vitals, and you can learn about becoming a NeedyMeds Volunteer Ambassador. So if you do have questions that I mentioned in the beginning, and I do see some have come in, you can submit them by typing them into the questions section of your GoToWebinar control panel. And as I get to those questions, I wanted to leave our contact information up as promised. So the first question coming in is there a fee for NeedyMeds? So we get that question all the time, and we're certainly hoping you reach out to us first if you are having trouble with your healthcare costs, because not only is there no fee to visit our website or call our helpline, it's also anonymous. That means we do not collect your personal data to either contact you to try a program that will help you. That means, we do not collect your personal data. And you can call us or visit our website free and anonymously so that we can connect you to a program that will help you save on or afford your healthcare expenses, or to provide you with our drug discount card. Thanks for the question. Another question, what is the website for clinical trials? Right, so the clinical trials was one of the two bonus suggestions about saving money. The other was lifestyle changes. But to find or learn more about clinical trials, the website is www.clinicaltrials.gov. And again, you'll see that in my PowerPoint presentation, which you can download because it's in the handout section of your GoToWebinar control panel. Now, as far as clinical trials, people enrolled in these studies receive free medical care, medications, and follow-up. Depending on the study, participants may receive new drugs with the potential of improved treatment. Again, all these studies must be approved by the FDA and at least one institutional review board. This protects the participants and ensures the testing protocols are ethical. The next question coming in, how can I get a NeedyMeds drug discount card? Great question. So on NeedyMeds.org, on the left-hand side, you will see a box with a red arrow that reads, Get Your Drug Discount Card. This will take you to our drug discount card page, which explains how to download our free drug discount card phone app, request a card be mailed to you, or print out a card. You can always call us at 1-800-503-6897 to request a drug discount card as well, and we'll drop one in the mail right away. So I'm going to wrap it up with these questions because I do like to keep the question segment brief. But if you did ask a question and I didn't get a chance to answer it, I will follow up with you. Thanks so much for your time. Have a great rest of the day, and we do hope you stay in touch.